sharing information, more efficient care, and better care is what Dr. Joseph Vasile is really aiming for with a group he started in Rochester. And I wanted to get more of the details straight from you, Dr. Vasile. You're trying to integrate more doctors to work together, and patients will really benefit from what happens with that effort, correct?
Yes. I'm leading a independent practice association called GRIPA, the Greater Rochester Independent Practice Association, which is a organization that brings together our healthcare system and all our physicians, both the employed physicians but also the private practice, independent community-based physicians as well. And we have an IT platform that links us together, that we're able to join with care pathways and guidelines, so we begin to practice in similar ways using best practice evidence-based criteria.
It sounds like you're ahead of the curve in some ways, and why is that? Because what you're doing seems to make a lot of sense.
About 5 years ago, the organization committed itself to becoming a clinically integrated network of physicians. So from that point on, we began to develop the IT systems and the care guidelines and pathways. So I'd say we're a little bit ahead of the curve. And now with healthcare reform, it seems as though the work and the efforts that we put into it now will really pay off.
And are you finding that patients are receiving better care from that because people have more information about them? There is not a duplication of services or testing. And
yes.
So do patients feel like they're better cared for?
Those are all areas that we focus on, and at the heart of what we do is that we are trying to improve the quality of care in an efficient way. So as an example, much of the work that we do allows us to reach out to patients that may have a chronic condition, let's say diabetes, but are not receiving the appropriate care. So we will be able to reach out to those patients and work with the physicians to bring those patients in for a visit, to get the appropriate lab testing done. And ultimately, that will prevent hospitalizations and reduce the cost of care. So it's a real win-win-win situation.
Are you finding that other people at this conference, for instance, are more interested in what you're doing than they may have been, say, 5 years ago?
Certainly. With this whole talk about healthcare reform, accountable care organizations, what we've been developing over the past 5 years seems to fit right in there and answer a lot of questions that we're all challenged to answer.
So how many doctors are in your network then? How many people are involved in this effort?
Well, we are a group of about 700 physicians, again, in Rochester, New York. Part of what our group has done is really actively engage the physicians, because without physician engagement is sort of a basic premise of all healthcare reform. We're not going to get anywhere. At one point, we had upwards of 150 physicians all actively working on some part of this clinical integration development.
Okay, and prior to getting together, these 700 were in what kinds of situations?
Well, the IPA is an older IPA. It's been around since 1996, but the business has changed since 1996, and it's really been in the last 5 years that we've focused on clinical integration or working together as a group of physicians.
And what sort of investment might other doctors in other states be looking at if they decide to take the same road that you did?
Well, a lot of hard work, although I think the pathway is getting at least a little bit more clear with the Accountable Care Organization Act. At least we know where we're headed, more at least than when our group set forth to do this.
Yeah,
so.
Absolutely. Great. Dr. Vasile, have I missed anything? This is very interesting.
I think you've covered most of the highlights.
All right.
Yeah.
Thank you so much.
Thank you.
You're watching continuing coverage of the World Healthcare Congress in Washington, D.C.